Okay, so could you introduce yourself and your position in the mobile clinic project?
Yes, my name is Lauren Hahn. I recently graduated from UCLA, but during my junior and senior year at UCLA, I was part of the Mobile Clinic Project as a caseworker and an advocacy committee worker.
So, what does mobile clinic project do?
So, Mobile Clinic Project, like its name, is a mobile it's a mobile clinic, and we set up in West Hollywood in the Salvation Army's parking lot where we provide medical services, social services, or anything else that unhoused clients are looking for. So we really emphasize that we're not just trying to serve a person's medical needs, but any social needs like referrals to mental health services, shelters, other food banks. We try to provide that holistic care.
That sounds great. So, what does being a member typically look like?
So, first and foremost, you are accepted as a caseworker, which you're paired up with medical students from David Geffen UCLA School of Medicine, and you're really in charge of being with a client during their visit at our clinic. So you're there just to provide emotional support, to get some social demographics, and just to like listen to their stories. A lot of our clients come in and they really just want someone to talk to, and caseworkers provide a lot of that emotional support. We don't do anything medical like at their blood pressure. That's like all up to the physicians and to the medical students. Secondly, you're a part of a committee. It's either advocacy, database, grant writing, referrals, or logistics. So you're a caseworker and then you belong to one of those committees.
That sounds really great. And it's nice to hear that students really get to be involved in something. So,
Yes,
what makes
absolutely.
your organization different from the other pre health organizations on campus?
Yeah, I think mobile clinic is definitely special because although we attract a lot of like pre-med, pre-health students, it's not only for pre-health students. People who want to go to law school, people who want to do public policy, they are welcome to join. We really emphasize, like North Campus majors from joining because we do see a lot of pre-meds, but it's not restricted to just people who want to pursue medicine. It's just for everyone who wants to serve their community. So I think that's really great.
Yeah, and so if you want to join your organization, is there an application process? If so, like what does the application process look like?
Yeah, so we recruit every spring. So unfortunately, when you are a freshman, your fall quarter, you can't join right away. So we recruit in the spring quarter. There's first a written application with a few questions. I think we get around 500 applicants per year. And then I think about half of those people are invited for an interview process. And then after that interview process, after the leadership teams, discuss, then you're invited to join as a caseworker for 1 year.
And what qualities distinguish applicants as strong candidates?
Just honestly, anyone who wants to serve, MCP does a holistic review, so we don't look at your GPA, we don't even ask for it. It's just anyone who's ready to learn and ready to serve the community, because I believe, if you haven't worked with like the unhoused community, we all have a lot of biases towards homeless individuals. And so just to always continue educating yourself about these housing policies, about these housing issues, and to be an empathetic person is all I think the leadership in MCP looks for.
That's great. So, reflecting upon your time with the mobile clinic project, what was like the most impactful personal experience you had while working within this organization?
Yeah, as an advocacy member and just as a caseworker in general, I talked to so many clients during, clinic shifts, and one really stuck out to me. It was I joined MCP during like the height of the pandemic, so we were doing virtual, telemedicine kind of via Zoom, like via meetings. But my senior year, we actually got to return to clinic in person. And so I met this client, and he was, the COVID vaccine had been out for a while, but he had past experiences that, really built this distrust against medical professionals and, doctors, nurses, any like medical staff. And so when he came to our clinic, he really wanted to get the COVID-19 vaccine, but he was hesitant. But because he had built like a long lasting relationship with our caseworkers, some of our like coordinators, some of our physicians, they were able to convince him that this was the best thing to do to keep him safe and to keep like his loved ones safe. And so to see that relationship that our staff had like built with them and how influential clients are to our lives and how we are to their lives was a really special moment to me, and how important it is to like build relationships with the community around you.
That's great. And so that's like the perfect bridge into our next question, that like you can take an individual experience and also see it on a much larger scale. So how does your organization really give back and impact the community on this like macro scale?
Yeah, I think as especially being a part of the advocacy community, we do a lot of outreach efforts like in the UCLA student body, and we try to educate and try to decrease the stigma around unhoused individuals. And so putting on events like Sponsor Home, where we, try to redefine what it means to be homeless, because homelessness is different for everyone who's experiencing it. Housing insecurity is different for everyone. And so spreading awareness through events like Sponsor Home or Homeless Awareness Week, where we collaborate with other organizations such as like Bruin Shelter. I think we really try to work within the UCLA student body to shine a more compassionate light on those facing housing insecurity. And I think that's something we really do to impact how people see unhoused individuals. And so I think that's something we do on a larger scale.
That's really great to hear. So, was there anything else that you haven't had the chance to share about the mobile clinic project that you wanted to talk about?
Yeah, MCP is probably the best thing I've ever done in my life. Like, it's such an impactful experience. If you're ready to serve your community, please apply this upcoming year. Um, the people who are in it are some of the best people I've met at UCLA. Um, and working with our clients was just such an amazing experience and something I wish that everyone could experience. So please consider applying, and you know, it's great to serve your community, and MCP is one great way to do it.
Sounds great. Well, thank you, Mobile Clinic Project and Lauren, for speaking with us today.
Of
Thank
course.
you.
Thank you.